me. I thought it would be nice just before we get started for everyone to just kind of join me in a few deep breaths just to relax and kind of set the stage so we can all be on the same page. So if you guys don't mind, we'll just do that for maybe 30 to 40 seconds. So if everyone could just kind of get into a comfortable position wherever you are, if you want to get to the floor, you can, or you can just kind of get comfortable in your chair. Just relax your shoulders, close your eyes, and just take 3 deep breaths in and out. Deep breath in, all the way out. Relax your shoulders. Just kind of pay attention to what's beneath you. Deep breath in. Deep breath out. And one more, deep breath in. And deep breath out. Okay, you can just open your eyes. And I like to kind of incorporate just a little bit of being present in the moment, because it's so easy to get overwhelmed and feel like you're drowning throughout pretty much every step of the way. And I wish I could tell you that it gets easier. In some ways it does, in a lot of ways it doesn't. But there's different challenges that you experience. And I think more than anything, it's learning how to cope and how to kind of deal with whatever situation is thrown your way. And that is something that can't really be taught, but it can be reinforced. And so I'll just talk a little bit about my personal journey, and I'm happy to answer any questions that any of you have. And I think they'll be doing a great job moderating for me. So I kind of knew that I wanted to be a physician from a young age. So I think that actually probably is a more unique thing at this point. I think a lot of people make that decision later, which is absolutely fine. For me, I think it was just exposure to medicine from my father, who was a physician, and I have many aunts and uncles and cousins who are doctors. So it just kind of felt like an organic path for me. And so I did my undergraduate at UC Irvine in science and got my bachelor's in science there. And from there, I went to Ross University in the Caribbean, where I did med school, the first 16 months there of the classrooms, and then spent the clinical rotation side mostly in New York, where I wanted to be. And from there, I matched in residency at UCSF in Fresno in internal medicine, spent 3 years there. And at that time, my boyfriend was doing his radiology residency in New York. So I applied for fellowship in GI, basically only on the East Coast in New York and New Jersey, and ended up going to SUNY downstate for my fellowship. I did 3 years there. In my 3rd year, I was the chief fellow. And then I took an appointment at Stanford University, where I've been working for the past 3 years as a clinical assistant professor. And just recently had a baby about 10 months ago, say recent, but I guess it was almost a year ago now. And so I had to make the decision to basically not be traveling back and forth, and we settled in Newport Beach. So I just joined the Institute of Plant-Based Medicine as a private practice gastroenterologist and obesity medicine specialist down here. So it was a long journey. It was definitely worth it, but I will say that there were many, many obstacles along the way. I was told at multiple points along this journey that I wasn't going to get to the next point. And so I was always making a backup plan, because I was convinced I wasn't going to match into residency in California. And then I was convinced I wasn't going to get a GI fellowship. Then people can kind of tell you things and make you feel like you won't be able to do something. You can either kind of take that in and let it consume you, or you can take it as a challenge and just really shoot for the stars, because if you fall, you land on a cloud. And that's the advice I was given by my family members, which I did. And honestly, it's worked out. I think what I could offer you guys more, I understand that most of you are pre-med. So, I mean, we can talk about, GI diseases and things like that. It's no problem. But I really think it would be more helpful to kind of give you some tips and tricks on how I made it where I am. And hopefully, if you guys have the opportunity to kind of incorporate that into your paths, I think it would be very helpful. So the first piece of advice I have is when you're choosing what field you want to go into, because it's a decision you have to make relatively early, just because you want to make sure that you're kind of getting your foot in the door, meeting the right people, is think about what makes you happy. Is it that you want to do procedures? Is it that you want to be available to do virtual medicine, which is kind of just on the rise right now? And there are some practices which are 100% virtual. It's totally doable that way. Do you want a job where you can have the flexibility of I have to work really hard for a week, but then I can have the next week completely off to go travel or be with my family or whatever? Or do you want to be delivering babies and experiencing that? So I think a little bit of it is you kind of have to go with just your personality and what you think. For me, I knew that I wanted to do something where I could use my hands as well as my brain. And that's why I chose GI. I did not want to live the life of a surgeon. Just for me, it wasn't my cup of tea. I loved surgery, thought about it, but then quickly realized that it wasn't the right fit for my personality. So that kind of narrowed it down to a few medicine subspecialties for me. It was pretty much cardiology or GI. And after I did my GI rotation, I realized that there's just so many different diseases that you treat. There's so many different types of patients that you get to see and procedures that you get to do, which are quick and not so stressful as surgery, but still very rewarding, and you can really save someone's life. And also do, preventative measures like colon cancer screening, which is something that's very close to my heart. So that's kind of what led me on that track. But along the way, there's definitely a lot of things that you can and need to do to make sure that you're setting yourself up to give yourself the highest chance of success. And one is take every opportunity that's presented to you that you think could serve you in a positive way, even if it's totally out of your comfort zone. For example, if there is a project someone's working on and you are even doing an observership or just rotating with them, whatever it is, but you think you might be interested in that, agree to write up the case report or agree to do the literature research, or just show interest and enthusiasm to be a part of something. That, I think, is a quality that I was given feedback over and over again that it showed how much I cared and how involved I wanted to be, and it really stood out. And I would say that is something, that I would highly recommend. Is it doesn't even have to be necessarily about research. I actually haven't published a lot of things. My, attributes and what I can contribute to a team is that I'm available and I'm enthusiastic, and you don't leave until the job's done. And if you have that attitude and you're eager and motivated, that's really speaks volumes, because it shows your work ethic and it shows that you are going to be a great physician in the future. And honestly, that's really what it comes down to. Not saying anything negative about those who love doing research. I admire them so much. I mean, at Stanford, my colleagues were really, truly like brilliant. And I could never do what they do, because they're just phenomenally amazing at research, and they're changing the world literally. And I think there's such a huge role for that, but it's not for everyone. And you should not get discouraged because you see someone else's CV when you're on the interview trail that has like 10 pages of all these articles that they publish, because I beat myself up a lot for that. And I mean, at the end of the day, I achieved everything that I wanted to achieve. So I would say, put your best foot forward, be, just always kind of available. Don't try to leave early if you are in a rotation, especially that is something you're really interested in. Those things, you may not think they matter, but they really do matter. And as far as kind of more just in terms of deciding what you want to do, the more exposure you can get, and you guys are lucky, you have a lot of resources, and I feel so old saying this, but that I didn't even have, and I think using these platforms and social media to reach out to people, and I'll share my email address with you guys after, like, feel free to email me anytime. I'd be happy to chat with you. But you can really get experience and exposure through other people and what they're doing. And you can kind of see if that specialty will allow you that flexibility in your life that you want, or give you that work-life balance that is really important. So fellowship for each specialty is obviously very different, as is residency for each specialty. But during fellowship, I realized that I I didn't want to work like that all the time. You need to when you're in fellowship, 100%. The tougher and more malignant the program, it's actually better for you because you get the most exposure, and that's the time when you have this shield of protection because you have others that you can ask questions to. So don't shy away from programs if you've heard that they're very grueling, because honestly, it's just, I mean, of course, everyone's situation is very different. If you have children or you have other things going on, I get it. But for the most part, if you really want to get an intense training and be very, experienced and feel confident leaving fellowship, it's really the malignant programs that will get you there. I decided to, been practicing general GI at Stanford, like I said, for 3 years. So that means seeing patients in the clinic at that time. This is all pretty much pre-COVID, because then I was on maternity leave during COVID. But it was seeing patients in person and doing procedures in the outpatient center, and then doing a few weeks a year of inpatient service where you're seeing the admitted patients. And it's a nice balance for sure. I felt academics is wonderful. I have nothing negative to say about my experience. It was like my dream job basically, but I had to make a choice for my family, which is why I went into private practice. But I think academics is absolutely wonderful. And there's so many different things you're going to hear along the way, and everyone wants to give you their unsolicited advice about what is the best thing and what's not the best thing. But really just follow your heart, take opportunities that are presented to you, and don't be discouraged, by other people telling you you can't do anything, because it's not their business. You can do whatever you want to do. People have different paths to get there. And it's just, you'll accomplish what you want to if you put your mind to it, if you put your best foot forward, and if you are actually truly genuinely interested in what you are doing. And it shows, and it speaks volumes. If there's a particular residency program that you want to get into, my suggestion is during med school, try to schedule as many elective rotations in and around that area as you can, because that is like a month or a 6-week long interview. And you go there with the intention that you're going to, plan to stay late, get there early, be extra prepared, offer to do presentations. Again, if they're working on research projects, ask how you can get involved. If there's interesting cases, you can do a case report. You can write things up, and if they don't get published, they don't get published. But at least if they do, wonderful. You have something that you can have forever. But at least it shows that you're engaged and making the effort. And that's when people remember you. And then as far as, I'm sure there's a lot of newer things going on in terms of virtual experiences and things like that. So I would kind of look in to see what different programs are offering. But I would say really just try to get your foot in the door as early as possible, wherever you're thinking that you want to be, if you know. For me, I knew I wanted to be back in California. So that was kind of the ultimate goal. And so we kind of, figured out a way to make that happen. And if you have to take a year off in between residency to get the fellowship that you want, that's totally okay. Like I said, I had my plan B from day one, and I wasn't even expecting to match in the fellowship right out of residency. So I was planning to be a hospitalist for a year on the East Coast, and then reapplying. Like that's what I'd already mentally prepared. So I was completely over the moon when I got my match results that I had matched. And, it's also okay to take breaks in between. I took 6 months off after I finished fellowship before I started at Stanford. And I'm so glad I did, because there were other jobs that I was considering, but didn't quite feel right. And I just said, let me just wait until the right job comes along. And honestly, it was absolutely worth the wait. So, you just have to kind of follow your instincts. Another piece of advice that I was given was starve before you settle. And I think at the moment I was like, yeah, it's easy for you to say, you're like a retired radiologist, but it was actually right when I was considering another job. And a week later, I got this opportunity at Stanford. So I'm really glad that I kind of held off on what didn't quite feel right, and just kind of relied on destiny to open more doors for me. Excuse me. So with that, I would love to answer any questions you guys have. I can go into more details. if there's any questions that are coming up on the chat, I'm seeing if the beginnings of a few.
Thank you so much, Dr. Kalra. This has been amazing so far. A lot of people love the mindfulness that we did at the beginning and all the information. One question that we had a couple of times was if you could go over the ways that workload or just life in general is different from academics versus private practice.
Sure. My experience is a little bit unique in that I'm kind of just starting right now with the private practice, and I'm doing it out of network. So I'm doing a cash practice, so it's a little bit different. But academics, especially if you're at a bigger, actually, I think any academic center, you don't have to worry about marketing yourself at all, right? The patients are just going to come to you. Like there's a whole, that whole aspect of it really is you just kind of show up, you do your job, you engage in teaching if that's important to you in some capacity. And it depends on the program if they expect you to do research or not. But if that's something that's important to you, that's something you should ask about what the expectations are. Some programs in academics they expect you to publish X amount of papers per year. Other programs have a clinical route and a research route, like that's what it was at Stanford. So actually there wasn't a major expectation for me to be pumping out papers because I was on the clinical route, which was, as I think you guys can ascertain, that's kind of my thing, is more focus on clinical medicine. So that's academics. It was awesome because you can work and collaborate with a lot of different people, and especially at a kind of tertiary care center, you get to see really, really unique cases because they're coming for like a 7th opinion or an 8th opinion, and those are, you know, diagnostically really challenging and interesting, and they kept me up at night a lot, not in the sense of like I couldn't sleep, but just reading up on different case reports and trying to figure out like what can I do to help this patient, you know. And a lot of times it can feel like a lot of pressure that, oh, they're saying like you're the only one who can help me, and it can be a little bit of pressure, but it was so rewarding, and I made some really, really cool diagnoses, and I helped people who otherwise really were kind of at their breaking point, you know. So academic medicine, I think it's awesome. You have a stable salary. That also depends though. There can be a few years where you're guaranteed a salary, and then after that it can be more how much you're producing and you get a percentage of that. So you have, each academic center is a little bit different, but in general, it's, you know, the salaries are pretty much standard within that area or region. And you have usually great benefits. So like at, you know, big university hospitals, like they'll give you often some sort of like just benefits for even your children and things like that. Like they would pay for part of their college or give you special loans, or they just have a lot of resources, especially larger universities that get a lot of grants and donations from people. So that's academics. Private practice is very much you are doing it for yourself. So you market yourself, you are putting yourself out there. I've been meeting with a lot of doctors, like concierge doctors in the area, to kind of get my name out there. And it's slower to start, but once you get established and once you start to get patients in, they'll start referring, you know, their friends and their family members to you, and then business just takes off. But it usually takes longer to get started. People say typically between 1 to 2 years before you really start feeling comfortable and like you have kind of patients coming in. So I'm learning the private practice thing as I go. It's all very new for me too. But for me right now, it's actually working out really well because I have my baby girl, and you know, for me, I actually want to spend more time with her at home, and so I'm okay with things being a little bit slow, you know, for the next couple of months, just so I can be with her a little bit more. So did I answer the question? I think it was more, okay.
Yes. Yeah, I think that was really good. You really gave us that distinction. So thank you for that. Sure. Kind of along the advice or the route of your private practice, there was people asking if you had any business background, or if you feel like that would have helped in starting your practice, or even like who runs that in a private practice.
Those are great questions. And honestly, I really think there should be some curriculum in medicine on business, because it absolutely is. And vast majority of people will go into some sort of a private practice situation just because there's a limit on how many academic positions there are and just the nature of the way things are. So I don't have any business background. My dad has been in private practice for like 35, 36 years now. And he did Palm critical care, and now he does sleep medicine, and he's always had like 6 offices. I don't even know how he does it seriously. But so I had that kind of in my mind of like how I saw things done growing up. And I have like talked to him about getting his input on things. I did not start this private practice. So this is actually, I joined a group, but I'm kind of working as an independent contractor with them. So what that means is I am my own, like I'm doing my own thing, but kind of under their name as right now. Like I'm not part owner or anything like that as of yet. And the overarching company is owned by Dr. Angie Sadeghi. She's pretty, popular on Instagram as well. She's another gastroenterologist who does obesity medicine. She's wonderful, and she's been like a mentor for me, and I feel really happy to have met her. So she's kind of already had this practice going, and she renamed it the Institute of Plant-Based Medicine because we also focus on lifestyle, diet, wellness, those things in addition to standard medicine, which is what I liked about it. And so I joined her. So everything was already kind of up and running, and she has the business stuff going, and I'm like an independent contractor working with her, if that makes sense. So I didn't start my own private practice, and I don't really do too much on the business side. I'm kind of learning as I go. And I think a lot of people say that. The advice that I've gotten from family members who are doctors who have just kind of done it is you just do it. It sounds really daunting and it sounds really scary. Solo practice is a little bit more challenging for quite a few reasons. One being, depending on where you are, just the overhead costs they can really add up. So what does overhead mean? It means your monthly lease. It means that whoever's in your office that is your staff, whether it's the person answering the phone, the billers, your legal team, whoever it is, you're going to have some people working with you and for you, because you can't be answering the phones, submitting prior authorizations, doing all that stuff and being a doctor. It's just too much. So whoever that person is, you're going to be paying for their health insurance. You're going to be paying for their, your own malpractice insurance, workman's comp. I mean, there's so many things that go into that. So as you can imagine, your rent is not going to be lower just because you're not busy. You're going to be paying X amount each month, regardless if you're seeing 1 patient or 1,000 patients a month, right? So in the beginning, you're actually probably going to be losing money. That's what most people say, just like any startup, right? Maybe that's more relatable, like any startup company. In the beginning, you're going to lose money, and then eventually, hopefully, as you get into a rhythm, you'll start to make more. I would say some people have taken like a year in between to get their MBA. And I think if you're planning to be a big, maybe take it to like the next level in terms of the business side, that is not a bad idea. I think they do really well and have just a better understanding of how a business is run. And you can probably work on cutting your overhead costs because you have a better kind of understanding of how those things work. I wish I did. I wish I would have gotten my MBA. Who knows? Maybe I still will online or something.
Thank you so much for answering that and giving as much information as you can. We appreciate that.
Sure.
We had some questions kind of going back to your journey, asking just about your experiences with Caribbean medical school. If you can give, your perspective of what it was like and getting into residency and all that.
Yeah. So, do you mean like is someone considered? So I missed the first part of it. Just kind of the general experience of going there.
Yeah, just how your decision to go, what it was like, and matching into your future residencies and fellowships, if that was affected at all.
Sure. So this is what I'll say. I went into college knowing that I wanted to go into medicine, but I didn't have the right study habits. And honestly, I just kind of my mind wasn't as focused on school at that time as it needed to be. I'm just being honest with you guys. And so my MCAT score wasn't the best. And so when I looked up what the average scores were for US med schools, I didn't feel I had a really good shot. And then I learned about the Caribbean med school actually through my dad. My dad's friend was an attending at a hospital where they got a lot of Caribbean med students in New York. And so he was the one who told my dad, well, if she really wants to go to med school, just have her apply. And he told me about Ross and SGU and what was the other one? American University, AUC. So I applied to all three. I got into Ross and basically just made the decision to go, because at that point it was either I do that or I take a year off and reapply. And I just felt that for me, I wanted to just kind of just go and just start the process. At that time, I was told by so many people that I would not be able to match into a residency in California. And that was while I was there in medical school, in the Caribbean, because even not early on, because it was just such a stigma that, oh, if you go to a Caribbean school, you're not going to match where you want. And so I was actually really sad about it. And I was like, did I make the right decision? But, you know, it was, I'm not going to lie to anyone, because it's extremely challenging. It was a very, very difficult time for me emotionally, because I was so far away from my family. There were many days where we wouldn't have like water. I'm not joking. Like if there was a hurricane, then the water would literally be like non-usable. So you would just have to like bathe with water bottles or brush your teeth with a water bottle. And it just wasn't really like anything that I was at all used to. Like my parents like, oh no, we used to do that in India all the time. And I was like, yeah, but it's different. Like I grew up here. Like this is different, you know? And there would be days like the power would go out because too many of us were using the internet to study for our exams, and like literally just didn't have internet. Like it was extremely stressful in that way. Also, it's a third world country, so things just weren't available or as clean or as the way we would like it. So it was 16 months, but it was a really long 16 months. That being said, I was literally studying 12 to 16 hours a day. Like it was almost to the point that it became a problem because I really wasn't sleeping that much. And I would just like stay in the library. And it was because of me that they changed the library to be open 24 hours, because I would be there till like 2 a.m. and they'd have to like lock up after me. And it was pretty intense. So I would say, if you're planning on going to a Caribbean med school, or if that's an option that you're considering, be very mentally prepared that it is going to be challenging. You will probably be working a lot harder than maybe your American med school counterparts, because they let in a lot more students than can graduate. And knowing that, it kind of creates a little bit of a different atmosphere amongst you and your colleagues. So I would say if it's an option, take it. You will achieve whatever you want. I mean, I feel like I'm a living example of that. And that's kind of why I wanted to share my journey with you guys, because if I told people when I was in med school, no, I'm going to be a professor at Stanford, they would have laughed in my face, you know, but that's literally what happened. And it happened exactly the way I wanted it to. So you can do whatever you want, regardless of where you go to school. You just have to really be hardworking, honest, and genuine about what you want to do, and you can get there. So don't be discouraged to go to a Caribbean med school. Things are going to be harder. People along the way are going to make you feel like you can't do anything, or like you might feel insecure along the way. And I did many times, but just stay confident, stay true to yourself. And if you do well from there, you'll do well throughout, because it takes a lot more grit and it takes a lot more stamina to do well. Does that make sense?
Yes, absolutely. And thank you so much for your honesty. There's so many messages in the chat right now, just really thanking you for your transparency and talking about something that often we don't like to talk about as people in healthcare. Just, you know, there's a toxicity that comes with it. So everyone feels that was really refreshing to hear that anything is possible and all that. So thank you.
Good, I'm glad.
Kind of switching gears, we had some questions earlier asking about your journey to incorporating mindfulness in everything, but if you can combined it with your practice, and if you've seen any results or if it's helped anything, both in your career and your own life.
Yeah, absolutely. So great question. So I'm actually relatively new on this mindfulness journey. And I think actually mindfulness is a journey. I don't think it's a destination you reach. I think it's something that everyone should in some way incorporate or is doing, whether you realize it or not. But I think we can be more purposeful about incorporating it into our lives. And the reason why, I think it was actually just probably after having, maybe while I was pregnant or like preparing to give birth. I don't know. It was a very obviously different life-changing experience, and I felt that I just wanted to be present in every moment and not miss anything. And so basically it's just a matter of kind of changing the way that you approach things and approach stressful situations, and also just being a physician, even throughout all of it, like schooling and just kind of all the things that you deal with. I think we internalize a lot of it, and we don't really ever even have a second to take a step back and just deal with it, whatever that was, And like I've been mentioning over and over again, people kept telling me no, and now I just say it like, oh yeah, people just kept, but in the moment it was heartbreaking. And of course, that's going to linger on in your mind and your psyche, and it's going to affect the way that you live your life and the way that you feel and your neurotransmitters, everything. So I think, like just being more aware of yourself, of your self-worth, of giving yourself a break too, is just absolutely a foundation to success. And you don't have to be sitting in a dark room, or in Japan in like a beautiful whatever boutique wood hut and like meditating. It doesn't have to be that. It can really be just what we did earlier, just a few minutes of just breathing and really feeling the breath, and just kind of realizing that this moment is the moment. This is life. It's not what happened already. It's not what is or isn't going to happen. It just is what is right now. And as far as how I found it useful, so within the field of GI, a lot of times we're dealing with patients who have irritable bowel syndrome or other sorts of visceral hypersensitivity, which is essentially where they're feeling abdominal pain to a higher degree, even if there really isn't anything there. It's just because the neurotransmitters just hyperdrive basically, or there's a lot of functional GI disorders, which essentially are symptoms of diarrhea or symptoms of constipation, but we can't really figure out any other organic cause for them. So that's when they get labeled as functional. And actually, a lot of that has to do with the gut-brain connection. And so that's really what I got interested in, because there's such a powerful connection there. And I think a lot of doctors, just by the nature of the way medicine is, you just don't have time to really sit down and explain to patients why they're feeling the way that they're feeling. And I found that when I actually took the time to do that, like literally would close my computer and just sit and talk with them and explain to them what's going on. Like a lot of times pre-COVID, patients would like hug me, and they would felt so happy and relieved, and they felt so empowered that they actually could understand what was going on with their bodies. And so in that way, I know that I've helped a lot of people, at least if just feel better, but actually understand and get a grip of kind of why they're feeling what they're feeling. And I think a lot of times the sad thing about a procedural specialty is that if someone has abdominal pain, right? And we go in, we do an endoscopy, and we say, oh, there's no ulcer, like you're fine, bye. And you never see them again or never talk to them again, but they're still dealing with their abdominal pain every day. It didn't really help them. If anything, it just helped you as the doctor to make sure that you wouldn't miss anything big, but that person is still struggling. And I think taking the extra time to think outside the box, to kind of give them the attention that they need, and just remind them and reassure them that it's going to be okay, and there isn't anything like an ulcer in there, but the pain is real. Just kind of having that approach has really, really helped. And I've gotten great feedback from patients about that. And I think there's a huge role in actually all aspects of medicine, but I think especially in something like GI, where we deal with a lot of those functional disorders quite often. I incorporate it in my life by trying to redirect my thoughts, because I am a type AAA person. I always have so many things going on at once. And now with Mia, it's exponential. And we just moved into a new house. I mean, there's so many things always, right? Everyone has their story. So like, it's just, I try when I'm feeling flustered to just really refocus my energy on my breathing and kind of see the words and see the thoughts kind of go through my head and experience that process, acknowledge that they're there, accept that they're there, and it's okay to get that way. It's okay to feel overwhelmed. You don't beat yourself up over it. You don't beat yourself up over feeling anxious. You acknowledge it, but you appreciate that you can also distract yourself from it and refocus your energy on breathing is kind of the easiest thing for me. And I realized through this also that I hold a lot of tension in my shoulders. So as you're going through this, you may just periodically remind yourself, okay, relax your shoulders, and you might or relax your jaw. Some people clench a lot, or so you just kind of pick up on how your body is actually holding on to that stress. And I just wanted it to be more known and more available, and that's kind of where my Instagram thing came about. Is I just wanted it to be a place of kind of just happiness and to remind people that it's okay to pay attention to yourself a little bit more.
Thank you so much. That's awesome. There's so many people saying that this is what they needed to end the week. So thank you for all of your information. Kind of going off of the mindfulness, someone asked if you had started incorporating mindfulness techniques in your life during medical school, do you think that you would have had a different experience or had like a better like coping mechanisms and things like that?
Absolutely. That's actually why I brought it up. And that's why I wanted to bring it up and share it with you guys, because you're at that unique point where you can change the way it goes. I felt like I just got thrown into it and by my own, choice, but I didn't really take the time or even have the awareness about it at that time. And I really wish I had, because at the end of the day, I was living like on the ocean, but I never went to the beach. And I'm such a water person, and that just kind of gives you a sense. Like I literally just sat in that library and just studied all the time. And I really think if I had taken even 15 minutes a day, just 15 minutes to myself, I probably would have been able to cut my time studying by a lot less. I would have been sleeping a lot more, which has a huge, huge, huge part to do with all of this, because if you're not sleeping well, you're not retaining. And there's this kind of like, it's a catch-22, because you feel like you need to be studying until the last minute. But if you don't sleep, then you're really not going to retain anything. And then you end up having to study even more, or it becomes just rote memorization. And anyway, so 100%, if you can incorporate mindfulness into your daily practice now, literally like 15 minutes a day. And what the quote that I heard that I thought was kind of telling is, if you don't have 15 minutes a day to do, well, they said for yoga, if you don't have 15 minutes a day to do yoga, then you really need an hour, right? Like you're so stressed out that you actually really need a longer period of time. So I'm not saying yoga per se, but whatever that means for you. There's also progressive muscle relaxation techniques that are really helpful that I've recently come across that I've been utilizing for myself too. And I'd be happy to share that link if you guys want, but you can also just YouTube it. It's just like basically tensing and relaxing like the muscles of your body and kind of feeling everything. So yeah, there's a lot of different ways to do it. I would highly recommend doing it ASAP.
That's awesome. Thank you. I think the chat, people are just saying like, we know that we need to do it. It's just hard to actually do it. So thank you for kind of like that kick in the butt to get us to actually do some mindfulness.
Yeah.
There was a lot of questions. You kind of practice like the plant-based medicine. So there's people asking like what diets out there are actually like valid, which are fads, like vegan, keto diets, and especially since you specialize also in obesity medicine, what you've seen that like works and doesn't work.
Yeah, great questions. So I think we're shifting gears a little bit here more to the medical side. So I'll just give you a little bit about a background in terms of, first maybe we'll just talk about diets and obesity, so weight loss. It really doesn't matter what diet you do when we're talking about the goal of being weight loss, in the sense that any diet, usually if it's done like continuously and rigorously, will give about 5-ish% total body weight loss. Okay. It's not a whole lot. And the reason is because it's very, very, very hard to follow a diet. Okay. That's the first point. The second point about that is if someone has issues with heart disease, if they have fatty liver, which is actually a recent study that just came out, then the Mediterranean diet specifically, and that's not a vegan diet, but a Mediterranean diet is actually beneficial. So eating fish, olive oil, just fresh produce, fruits, those things, that's actually the best. If I had to say something, I would say the Mediterranean diet is the best diet, because it has actually shown benefits in preventing cardiac disease, as well as most recently with fatty liver. And it does help with weight loss, as I said. But again, when it comes to weight loss, it doesn't really matter which diet you use, as long as you're using a diet and that it's lower in calories than what you were taking in. And it can get a little bit more specific based on, the person, their body mass index, what other issues they have going on. Rarely is diet alone enough to help someone who's kind of at the class 2 or class 3 obesity. It's often just a combination of things. It's lifestyle. So exercise, you can't really lose weight just by diet and maintain it without exercise, if that makes sense. So in general, the way I think about it is, for weight loss, 80% of it is diet, and 20% of it is the other stuff. And, in order to make sure that we're not missing anything when a patient comes in to see me who is suffering with obesity, I kind of do some routine blood work, but I also do some special tests to make sure we're not missing anything, like thyroid disease. Just yesterday I had a patient and she's been dealing with difficulty losing weight for a long time. And it turns out she has really, really, really bad sleep apnea. And with sleep apnea, you're waking up multiple times a night because you're not getting enough oxygen to the brain. And if you're not getting restful sleep, then your body's cortisol and hormones are just not cycling properly. So patients who have sleep apnea that isn't treated have a very, very difficult time losing weight. And I'm so happy that she listened to me. I told her like 5 times at each point, like, you need to get a sleep study, you need to. And she finally went, and it turned out she has severe sleep apnea. So I think once she gets that treated, she's going to actually find that the diet and the other things are actually going to help her. And there are weight loss medications that we add in conjunction to diet to help patients, especially if they have a body mass index over 30 or over 27, in addition to diabetes or high blood pressure or high cholesterol. And if any of you are curious about body mass index or how to calculate it, you literally just Google BMI calculator, and there's one by the NIH. Just type in the height and weight, and it'll tell you right there. And it even has a chart at the side as to what the normal values are. Vegan diets. So avoiding dairy in general is good in the sense that it tends to be very inflammatory on the gut. It is also, people tend to feel bad when they eat dairy. Why? Because lactose intolerance is extremely common. And depending on your ethnicity, you'd be probably really surprised. So Asians over 90% of Asians are lactose intolerant, and Hispanics, the same thing. So if you are eating, or if you're not even feeling fully well, like maybe you're not having full-blown diarrhea or gas or anything, but you just don't quite feel well after eating certain meals, make note that it could be dairy, mayonnaise, ice cream, milk, those sorts of things. So it's kind of, the vegan diet per se hasn't been proven, as far as I know, to be superior to any other diet for weight loss purposes. And like I said, for overall health, it's the Mediterranean diet. I myself am not vegan, I'm vegetarian by choice, but I haven't been vegetarian my whole life. There was definitely a time when I ate meat, and it was just a good choice that I decided to make. But our office and doctors are not trying to make anyone vegan or anything like that. It's just a matter of addressing and incorporating lifestyle into our practice.
Great. Thank you so much for clarifying that and giving us some insight. We had a question kind of going off of that area. If you have any opinions about intermittent fasting, because we've heard a lot of mixed reviews from other doctors, so I want to hear your take.
Yeah, so intermittent fasting is actually great. I think it does work for people. And I think that with intermittent fasting, you also patients don't feel like they're being as deprived because they can eat whatever they want, but they don't feel like they're, being deprived of anything, because it's not about what you're eating as much, but it's about the hours during which you're eating. But personally, like, I do still think it's really important to focus less on processed foods, less on refined sugars. And see, it's different for different topics. Like, if we're talking about cancer prevention, for colon cancer, for example, a high fiber diet that's low in processed foods, low in sugars, low in sugar sweetened beverages, and even sugar-free beverages, that is what we know prevents colon cancer. So if we talk about, for example, cholesterol, then perhaps the keto diet would be worse for some people, right? So each patient and each situation is a little bit different. But for intermittent fasting, so it's hard for me to say that for everyone intermittent fasting is okay, because if everyone's just eating bacon from 12 to 6, that's probably not going to be good for you, even though it technically falls in the okay range for intermittent fasting. So I think it has to be very patient specific. And I still say, if you focus on whole foods, like whole grains, and be as plant forward as possible, incorporate as many different plants into your diet as possible, that is the way that you set up your gut microbiome, which are the trillions and trillions and trillions of tiny little bacteria in our gut. And they control everything in our body. And by incorporating a diversity of plants, we're really able to reshape that. And that's how we see long-lasting health benefits in every facet of life and every organ. So that's what the focus should be on. If you're able to do that during less hours of the day, that's even better, because it's just less calories. Excuse me.
Awesome. Thank you so much for sharing that.
Sure.
There's a whole discussion about everything you're talking about, as you said. So many side discussions going on right now. But actually, I think it's a good idea to talk about. So there's also a discussion about BMI. That's the side discussion, about how is it in your opinion actually a good reference point when looking at it, because we've heard a lot of things about how it's not that accurate. It has a lot of issues.
Sure.
They're not representative.
Yeah, no, it definitely, because you're talking about muscle mass, right? Also. So BMI alone is not ideal, but it's kind of the best marker that we have. And unfortunately, or fortunately, whichever way you look at it, that's what the studies have been done with, is BMI. So when we talk about data and guideline-based things, that's kind of what we're using. But yes, it is not for everyone, like especially if someone is extremely muscular, right? Because then it's not fat, it's more muscle, but it's still, they may still have an elevated BMI. Excuse me. So that's why waist circumference is also used. And more studies are coming out now where they're utilizing waist circumference in addition. So I think also, when you're seeing a patient, you're seeing them, like you have that discussion with them and you can actually evaluate them. So I'm not going to tell a person who's extremely lean otherwise that they're overweight or obese because of a BMI. It's a clinical judgment, but for the most part, in general, it's a pretty good tool. I mean, it's really kind of all we have, short of doing really, really expensive tests that are really not widely available and require expensive machines to measure, like different thermogenesis and all that stuff. It's just not realistic in clinical medicine. So for the most part, we use it, but yes, it's not 100%. I completely agree with you.
Great, thank you for that. Yeah, as Yasmin said, there was a really big conversation in the chat about that. So thank you for giving us your take on that.
Sure.
There was also some people wondering about like what your thoughts are and like what you recommend to your patients in terms of supplements and vitamins. Is that kind of just like dependent on each person, or is there something that you widely recommend for people to take?
Sure. I don't recommend supplements. Usually, that's what I'll just say, that so that hopefully that point gets across. Supplements, even probiotics, are not regulated like drugs are. They're regulated like foods are. So anyone can sell anything to you and you don't really know what's in it. And they did studies on a probiotic strain that was actually very, very, very widely used. And when they changed the manufacturer of this, and actually looked at those probiotics, and these are prescription probiotics, by the way, and looked at those underneath the microscope, they saw that it wasn't even the bacteria that was on the label. So there's been a lot of controversy about this, and I exactly see why, because there's no set regulations on what actually has to go in it and what it's formulated with. So my personal philosophy is, if someone has their vitamin D level checked and it is low and it needs supplementation, I would offer them a supplement. But I'm not going to offer people like digestive enzyme supplements just because those are a very fad thing to do. And there's liver detox supplements. They can get extremely expensive. And there's just no data to show that they do anything. And if anything, they could even make things worse. So I would say, if someone needs vitamin B12, for example, yes, supplement it. The one exception to this is actually fiber. So fiber is super, super important. And if you guys are on Instagram, you can follow me or read my post from yesterday. I kind of went into all the health benefits of fiber, and it's pretty amazing. And the reason is because fiber is like the fuel that we need for our gut, and you get it basically from plants. And you can get them from a diversity of plants and vegetables. As I mentioned earlier, that's the best way to do it. But a lot of times we're just not getting enough. And for women, typically around 25 to 30 grams a day is recommended. And for men, closer to 30 to 35 is recommended. And when we did studies on this, we found that over 90% of Americans are not getting enough. And we're getting about half of that. So because of that, I will sometimes recommend Metamucil or Citrusel. I just saw one comment and someone said that's a lot of fiber. So it's so interesting. There's a really good scientist. He's wonderful at Stanford, Justin Sonnenberg, and he wrote a book called The Good Gut. And he gave us, it really felt like a TED Talk. It was pretty phenomenal. But he was talking about how he's studying the microbiome. And he went to the old this rural place. I think it was in Africa, if I'm not mistaken. And they're basically like the true hunter-gatherers that remain. I think it was in Africa. It could have been, I just don't remember exactly. But he said when he went there to evaluate their microbiome, he found that they were getting something like 150 grams of fiber a day. And am I frozen? Can you guys hear me?
You're good.
Okay, because my screen is frozen, so that's fine as long as you guys can hear me. So they were getting like 150 grams of fiber a day. And when they look at their microbiome, that is actually what is closest to what the ideal human microbiome, like how it used to be, 150 grams a day. So 35 really isn't that much. I agree. If you eat it all at once, you're probably not going to feel great, but putting it in your diet slowly and really focusing on fiber is super, super helpful. But a lot of times we just can't do it. So in that sense, I recommend Metamucil or Citrusel or Benefiber as an adjunct into otherwise healthy diet to get to that.
Thank you. Someone also asked if you could repeat what the name of the book was that you just mentioned.
The Good Gut.
Okay. And I think someone said they're also reading it for their class. So
that's
cool.
Yeah, interesting too. He's a really great writer as well. He's just awesome.
So we'll do, I guess, one more question before we start wrapping up.
Oh yeah, sure.
The time flew by.
Yeah.
So there was a couple people wondering throughout the presentation, in terms of COVID, if you have noticed any gastrointestinal long-lasting issues, or if you expect to see any as the next couple of weeks or months go on.
Good question. And you guys, I actually wasn't really working during COVID because I was on maternity leave at that time when it was kind of peaking. So I've just been seeing patients virtually. So I'm not the best resource for that. So I don't want to tell you anything that's not true. But in my experience so far as COVID related anxiety and stress causing worse IBS, 100%. I can definitely attest to that. But if you're talking about things like specifically like it was like COVID-induced diarrhea or something like that, I just don't know, because those are mostly hospitalized patients, honestly, that are dealing with those severe symptoms. So I don't know that, but definitely it increased a lot of stress and anxiety, and that caused a flare of all those functional GI disorders that I was talking about. So I have been seeing a lot of patients with irritable bowel syndrome that's gotten worse this past year. Absolutely. I hope that, with irritable bowel syndrome and other things like that, that are that gut brain axis we were talking about, it's kind of, it ebbs and flows. So it's going to get better at times and worse at times, and stress kind of triggers it. And then when you kind of mitigate that stress and things get more calm, then patients feel better. So I hope that these aren't super long lasting effects.
Great. Thank you for sharing your experience, and we hope so as well. And kind of we'll use COVID as our wrap up. We're pre-med students in the heart of the COVID-19 pandemic, and your whole talk has really been really good advice for us and good points. And we were just wondering if there was one last piece of advice that you would leave us with, what that would be.
Yeah. So as stressful as it is and as grueling as the process is, really, really enjoy it. And one quote that really resonated with me was, "The days are long, but the years are short." And it's so true. It is just so true. And when you're going through something and you really feel like, oh my God, this is it, just take a step back, take a deep breath, and remind yourself that you will accomplish what you want. You will get there. And this will just be something that you're on Zoom talking to other people about in a few years.
Thank you so much, Dr. Kalra. This was awesome. I think if you open up the chat, you can just see like all the thank yous and all the praise.
Oh, sure. Thanks, guys. I really appreciate it.
Of course, this was awesome. I know that I definitely